Seroquel, Quetiapine, is a powerful medication that serves various purposes in the medical field. Whether you're seeking answers for yourself or a loved one, understanding its common uses, advantages, potential adverse effects, dosage guidelines, and dangers is crucial. Common purposes of Seroquel. Seroquel is primarily prescribed to treat mental health disorders such as schizophrenia and bipolar disorder. Schizophrenia is a chronic mental disorder characterized by hallucinations, delusions, and disordered thinking. It can be debilitating for those affected, and Seroquel offers relief by balancing certain chemicals in the brain. Bipolar disorder, on the other hand, is a mood disorder that causes extreme shifts in mood, energy levels, and behavior. Seroquel is commonly prescribed to stabilize mood swings, reducing the frequency and intensity of manic and depressive episodes. In addition to these primary uses, Seroquel also has off-label purposes. Off-label use refers to using a medication for conditions not officially approved by regulatory authorities. It can include treating insomnia, anxiety-related disorders, and even as an adjunct treatment for depression. Overall, Seroquel provides relief for individuals suffering from various mental health conditions, helping them regain stability and improve their quality of life. Advantages of using Seroquel. One of the remarkable advantages of Seroquel is its versatility. While primarily prescribed for mental health disorders, it has shown efficacy in addressing other conditions. For individuals experiencing sleep disturbances, Seroquel can be a valuable option. Its sedative properties help promote a more restful sleep, aiding those with insomnia. Additionally, Seroquel can be beneficial for individuals with anxiety-related disorders. It helps reduce anxiety symptoms by calming the mind and promoting relaxation. This broader range of application makes Seroquel a valuable medication for those with multiple conditions or symptoms. Moreover, Seroquel is available in different formulations, including immediate release and extended release tablets, allowing healthcare providers to tailor treatment plans to the specific needs of their patients. This flexibility ensures optimal dosing and effectiveness. Potential adverse effects of Seroquel. As with any medication, there are potential adverse effects to consider when taking Seroquel. It's important to be aware of these risks and discuss them with your healthcare provider. One commonly reported side effect of Seroquel is drowsiness. This can affect daily functioning, especially when starting the medication or adjusting the dosage. It's crucial to exercise caution when operating machinery or engaging in activities that require alertness. Dizziness is another potential adverse effect, especially when standing up or changing positions quickly. It's advisable to rise slowly from sitting or lying positions to minimize the risk of falls or injuries. Weight gain is a concern for some individuals taking Seroquel. The medication can cause an increase in appetite and metabolic changes, leading to weight fluctuations. Regular monitoring of weight and discussion with a healthcare provider can help manage this potential side effect. Another aspect to consider is the impact of Seroquel on cholesterol levels. It has been associated with increased cholesterol, so regular cholesterol checks and discussions with a healthcare provider are important for individuals on long-term treatment. Dosage guidelines for Seroquel. Dosage guidelines for Seroquel will vary based on your specific condition and medical history. It's vital to follow your doctor's instructions carefully and avoid self-adjusting the dosage. When starting Seroquel, healthcare providers typically begin with a low dose, gradually increasing it based on individual response and tolerability. This approach allows for better symptom management while minimizing potential adverse effects. The timing of Seroquel administration is also important. Immediate release tablets are usually taken 2 or 3 times per day, while extended release tablets are taken once daily. It's crucial to adhere to the prescribed dosing schedule to maintain consistent therapeutic levels of the medication in the body. If a dose is missed, it's essential to take it as soon as remembered, unless it's close to the next scheduled dose. Doubling up on doses should be avoided. Dosage adjustments may be necessary for individuals with liver or kidney impairment, as these organs play a role in metabolizing and eliminating the medication from the body. Regular monitoring and close communication with a healthcare provider are crucial for optimal dosing. Dangers and precautions associated with Seroquel. While Seroquel can be highly effective, it also carries certain risks. It's essential to educate yourself on the potential dangers and carefully weigh the benefits and drawbacks with your healthcare professional before starting this medication journey. One significant concern is the potential for cardiovascular events. Seroquel has been associated with an increased risk of heart-related issues such as heart attacks and strokes, especially in elderly individuals with dementia-related psychosis. This risk should be evaluated by a healthcare provider, especially for patients with pre-existing cardiovascular conditions. Additionally, Seroquel can cause a condition called neuroleptic malignant syndrome, NMS, which is characterized by high fever, muscle stiffness, confusion, and irregular heartbeat. NMS is a medical emergency that requires immediate attention and discontinuation of Seroquel. Seroquel may also lead to a movement disorder called tardive dyskinesia, which causes involuntary muscle movements, particularly around the face and tongue. Regular monitoring for this adverse effect is essential, as early detection can lead to better management outcomes. Lastly, Seroquel can interact with other medications, including over-the-counter drugs and herbal supplements. It's important to disclose all medications and supplements to your healthcare provider to avoid potential drug interactions. Seroquel alternatives. While Seroquel is a widely prescribed medication, there are alternatives available for individuals who may not respond well to it or experience intolerable side effects. For the treatment of mental health disorders, alternatives to Seroquel include other atypical antipsychotic medications such as risperidone or olanzapine. These medications work in similar ways to Seroquel but may have different side effect profiles. In cases of insomnia, alternative sleep aids such as trazodone or melatonin may be considered. These medications specifically target sleep disturbances and can be effective for individuals with difficulty falling asleep or maintaining sleep. Anxiety-related disorders may be managed with other medications such as selective serotonin reuptake inhibitors, SSRIs, or benzodiazepines. These medications work by different mechanisms and can provide relief from anxiety symptoms. It's important to discuss alternative options with your healthcare provider to find the most suitable medication for your specific condition and needs. Seroquel in the treatment of specific conditions. Seroquel has shown significant efficacy in the treatment of specific conditions such as bipolar disorder and schizophrenia. For individuals with bipolar disorder, Seroquel is commonly prescribed to stabilize mood swings. It can help reduce the frequency and intensity of manic and depressive episodes, leading to a more balanced and manageable life. Regular monitoring of symptoms and close communication with a healthcare provider are essential for optimal management. In the case of schizophrenia, Seroquel plays a crucial role in managing the symptoms associated with this chronic mental disorder. It helps reduce hallucinations, delusions, and disordered thinking, allowing individuals to regain control over their lives. Combined with therapy and other interventions, Seroquel can significantly improve the quality of life for those with schizophrenia. It's important to note that Seroquel is not a cure for these conditions but rather a tool to manage symptoms. Ongoing treatment and close collaboration with healthcare professionals are essential for long-term stability. Seroquel and off-label use. As mentioned earlier, Seroquel has off-label uses, meaning it is used to treat conditions not officially approved by regulatory authorities. Off-label use can include treating insomnia, anxiety-related disorders, and even as an adjunct treatment for depression. While off-label use can provide relief for some individuals, it's important to discuss these options with a healthcare provider and weigh the potential benefits against the risks. Off-label use may require additional monitoring and consideration of alternative medications that may be more specifically indicated for the condition. Conclusion and final thoughts. Seroquel offers hope and relief for many individuals battling mental health disorders. By understanding its common purposes, advantages, potential adverse effects, dosage guidelines, and dangers, you can make informed decisions regarding your treatment plan. It's crucial to work closely with a healthcare provider to determine the most appropriate dosage and monitor for any adverse effects. Open communication and regular check-ins can help optimize treatment outcomes and ensure the best possible care. Furthermore, it's important to consider alternatives if Seroquel is not well tolerated or effective. There are alternative medications available for different conditions, and a healthcare provider can guide you in finding the most suitable option. Remember, Seroquel is a valuable tool in managing mental health disorders, but it should always be part of a comprehensive treatment plan that may include therapy, lifestyle modifications, and other interventions. With the right support and guidance, individuals can find stability and improve their overall well-being.